Hello, everyone. I'm Anna Pettigen, Executive Vice President of Product and Strategy at GovExec, and it's my pleasure to welcome you to today's session, The Future of Care, Integrating Technology for Better Outcomes, presented by Deloitte. The digital transformation of healthcare is reshaping the way services are provided with cutting-edge technologies and substantial improvements to patient outcomes, operational efficiency, and cost control. Public sector healthcare leaders are increasingly leveraging innovations such as data analytics exchange, artificial intelligence, automation, and integrated information systems to provide more personalized care than ever before and meet the evolving needs of diverse populations. As the industry continues to rapidly evolve, what strategies should organizations prioritize to stay ahead in this ongoing transformation? And here with me to discuss, I have Andrea Fletcher, Chief Digital Strategy Officer and Director of Digital Service with the Centers for Medicare and Medicaid Services.
Hi.
And then I also have Latrice Prince-Wheeler, Acting Deputy Chief Digital Health Officer with the Veterans Health Administration.
Great to be here.
Thank you both for joining me. It's exciting to have this powerful group together, and we're going to dive right in with our first question. So I'm hoping to hear a little bit more about how your agencies are approaching the idea of digital transformation. What are some of the key stepping stones or initial priorities that you've set as leaders within your organization? Andrea?
Yeah, so for us at CMS, we have a very large organization. We serve about 150 million Americans with Medicare, Medicaid, and the marketplace or healthcare.gov. So we touch a lot of people in the country, and because our organization is so huge and impacts so many, just normal Americans, a lot of what we're focused on with digital transformation is customer experience. So how are we improving the experience for real people who are going to our websites and signing up for healthcare? And then within the organization, culture change around that. How are we refocusing our organization to make sure that we're gathering feedback from the public, making sure that we're investing in user research, and that's a key component of the work that we're doing, that we're actually talking to real people about how they use our services. And that's a shift in the federal government. I think it's a pretty big one to kind of get people to refocus on, okay, we know that we have to build technology, but let's get it right, and let's get it right the first time by engaging with the people that we're building for and working really with our users. And so it's been kind of the first focus for the agency, is just really how do we improve our overall customer experience and engagement, and get the agency to focus on the users and the people that we serve.
That's great. Latrice?
I would say for VA, the Veterans Health Administration serves about 9.6 million veterans every year that are enrolled into the healthcare system. So how we think about digital transformation is really trying to improve that digital health experience. So how veterans access care, how our care team members deliver care. And so when we try to think about our digital transformation, we're really trying to focus in on certain journey areas. How do we manage care? How do we schedule care? How do we deliver ambulatory care? And getting the agency wrapped around that sort of product operating model in terms of journeys is a transformation. That is not new. Most people are used to delivering care in a sort of an episodic way, but trying to focus the agency or the enterprise on digital transformation in terms of journey areas, I think it's very new for us.
It's great. So a lot of change and shifts in operating models, but I do think we'll hear a lot about that patient journey, that customer experience focus throughout. First, I want to talk a little bit about those significant technologies that are changing the healthcare industry and we're really driving digital transformation. Can you share about some of those technologies that are impacting patient care and things that you're leveraging within your organization? Andrea, I'll start with you again.
Yeah, so one huge focus of CMS, and I would say the healthcare industry as a whole, is interoperability, or how we exchange information between different healthcare providers or organizations. And that's, a lot of that has to do with implementing data standards, and there's a lot of legislation around this. I don't want to get too in the weeds on it because it gets really nerdy really fast. But how are we driving towards standards in the industry, particularly data standards and interoperability standards, so that way when you go to one hospital and then you go to another hospital, that it doesn't matter, that you have a seamless experience and we're able to move your information across. And that for us, people don't just sign up for Medicaid one day and stay on that for their entire life. Many people are going from Medicaid to the marketplace to employer-sponsored insurance back to Medicaid, and then eventually they'll age into Medicare. And so we want to make sure that we're able to have their information flowing throughout the healthcare system, regardless of who their insurance payer is and who their provider is.
Makes a lot of sense. Latrice?
I would say the digital technologies that we're focused on go back to delivering access to care. So how do we make the care experience more personalized by allowing our veterans to generate their patient-generated health data, share that with their healthcare provider? How do we provide clinical decision support at the point of care where our providers can actually look up information while they're talking to the patient? Or how do we actually reduce clinical administrative burden by providing things like ambient scribe so the provider can spend more time with the patient instead of actually documenting while the patient is there? And I would also say, we're really focused on immersive technology in terms of alternate reality, virtual reality, which actually helps what we've seen to improve patients who have pain management issues or mental health conditions, any of those therapeutic issues. Immersive technology has shown to be a promise for us. It's also shown to be a promise for actual clinical training. And so I would say immersive technologies is something that we are going to hone in on, not only on the patient perspective, but also from the clinician trainer perspective.
Very cool. So it is an exciting time for VA, for digital VA transformation, and now the VHA Digital Health Office. Latrice, can you share a little bit about the parts of the VA enterprise that are coming together to really create this digital health office?
That's a super exciting question. As the acting deputy chief digital health officer, listen, we're delivering more care to veterans than ever before, and VA really saw the need to bring all of our digital health capabilities together. To that end, we wanted to make sure we scaled digital innovation appropriately and fast. And so those digital health capabilities that came together include our Office of Connected Care, which is all of our virtual care solutions. It's also our Connected Health team, which is all of our patient-generated health data and health apps. Health informatics, which facilitates that seamless exchange between providers in our community and with our current health system. We have a new office called Artificial Intelligence and Emerging Technology, and that's focused on digital innovation. We also have a new function called Digital Health Experience and Integrated Product Delivery, and that is what I'm super excited about because it takes product managers from the United States Digital Service and helping us define what a product operating model looks like, making sure that we connect with our end users first and then figure out how do we solve our problem before we determine how do we build a problem.
Awesome.
Yeah.
Lots of exciting stuff at VA and across the board. So we talked already about some technologies and some specific initiatives that y'all are working on within your offices, but I'd love to hear how are some of those initiatives really helping evolve with the needs of a diverse and growing population?
Oh gosh, that's a great question. Medicare is very interesting, right? Because Medicare is generally an older population, right? People age in at around 65, and the demographics are changing. And often when I think about how our beneficiaries engage with Medicare, I think about actually my grandparents. So my grandparents would have signed up for Medicare by physically going to a Social Security office and filling out a piece of paper and giving that to someone, and weeks later, months later, their card would have arrived in the mail, right?
Yep.
And my parents actually just signed up for Medicare, and while the digital experience is not what I would want for them, their first instinct is to go online, right? To go online, maybe they'll call a call center, but they want to pull up their tablet or their computer and fill out a digital form. And I think about, well, okay, what's the next generation? What's my generation? Hopefully someday I make it to Medicare. And what is my experience going to be like? And how do we get ourselves to that? Maybe there is no sign-up process. Maybe you're automatically enrolled. Maybe you're using an app. Maybe there's some technology that we don't even know exists yet, right? And so how are we kind of building for that future, but then also improving, the experience of people today? We have 10,000 people a day that sign up for Medicare. It's a lot, yeah. And they have an expectation that is as easy as ordering food to their door, right? They want to do it fast. They want to do it, efficiently in the right way. And it's a really big decision they're making. They're making decisions about their healthcare. And so we need to give them the right information to make those choices, and have a delightful user experience. But it is a challenging situation.
Right.
I'll be honest. So I think what we're kind of thinking about is, what does the future need to look like for really, enrolling is one of the biggest ones. But then there's picking your plans every year and how are we guiding people through that process? I think AI is going to change that significantly. We're seeing people ask an AI agent to help them with this decision making. They don't understand the terms. They don't understand, what's in front of them. So can we give it to them in the language that they speak, in plain language, because it's very technical information. So we're kind of seeing it all evolve right now, and I think it's definitely going to change over the next couple of years really quickly.
Right. Yeah, it's interesting to hear about how you're balancing both expectations given the evolving nature of the world we're in. And
yeah, and the policy was designed for my grandparents' world.
Right.
The policy was designed in the 1960s when you had to physically go to a location. And so really trying to work within these programs that are 50, 60 years old, and have them meet modern expectations.
Latrice, do you want to provide some thoughts and your perspective from the VA?
Sure. I would say in VA, we are always focused on providing access to care and timely benefits to our veterans. And so we want to make sure that we provide the soonest and best care to them wherever they're located. And to that end, we have over 50 specialties participating in telehealth. We have clinical resource hubs at all of our regional networks, which means that if Latrice is in North Carolina and she needs to see a mental health provider and there's no mental health capacity, she can tap into the network in New York and see a VA provider in New York through one of these clinical resource hub agreements.
Wow.
I think we also have an opportunity in VA to participate in remote patient monitoring. So patients who actually need chronic care management, they don't have to actually come in to see their provider all the time or weekly. They can actually touch base with their healthcare team, on a daily basis via some sort of digital solution.
It's amazing. Lots of cool stuff going on. So I want to shift a little bit and go back to Andrea to talk about the interoperability piece that you mentioned earlier. How can open source solutions improve outcomes across the nation, and what are some of the progress areas that are happening today?
Yeah, you mentioned open source. It's kind of my favorite thing. Yeah. So at CMS, we set up the first open source program office in the federal government. And part of this is because we deal with the healthcare sector, which is about 20% of the US GDP. And there's a lot of technology in that space. And there's a lot of technology that CMS has to interact with. And so one way for us to do that better is to actually just build things in the open. And so we've kind of gone all in on this. We've done several projects now around how we collect quality of care data. We've done projects on price transparency, hospital price transparency, where we actually build the software out in the open. And that allows organizations who have to comply with regulations, be able to kind of see how we're working, see where we're going to check things. It allows people to take the software that we're building and build on top of it or build new things with it. So really looking to kind of drive the cost of software implementation down for the private sector and increase compliance rates, because it's less of a guessing game of, hey, what are they going to ask us about? We're like, nope, it's already here. You can see everything. You can actually take this algorithm that we're running and run it on your own machines. You can contribute back to it. And it's been a kind of interesting shift to see. I think people are a little bit surprised whenever they're like, wait, you guys are just giving us this? And we're like, yeah, have it. And so we've started to do this more and more and more. This is part of why we set up the open source program office. So we have kind of a center of excellency for this. We have the largest, they're called bulk FHIR APIs. That's a lot of acronyms. They're big data exchanges with Medicare data. Those are all open source. And we're just continuing to drive in this direction. And we've had huge success in it. And I think we'll be continuing to go that way for the foreseeable future.
I'm going to go off script a little bit and ask if other agencies are looking or organizations are looking to do something similar. Are there any recommendations or pieces of advice that you'd provide, just given all the progress that you all are trying to make?
I mean, reach out to us.
Yeah.
We're open source. We're very open to talking. I know, right? We've been partnering a lot with CISA, I'll give you another joke, the Cybersecurity Infrastructure and Security Agency. They like security so much, they put it in there twice. So we started partnering with them a lot on this, mostly because people were saying, if you build your software out in the open, it's going to be less secure. It's actually the exact opposite. The software is more secure because more people are looking at it. We're doing more checks before we release it. And so we've been working with them a lot and their open source team. We've done some really cool open source summits and conferences and things like that with them. So, they're all over the place talking about this.
There's information out there, but you're always open to talking more. So that's great.
Yeah.
I'm going to shift gears a little bit and talk a little bit about clinical administration and reducing that burden to provide improved care. How are some of the digital transformation efforts really ensuring care teams have the access to the right data at the right time? Latrice, do you want to kick us off?
Yeah, sure. I would say that for VA, we are really focused on an effort called Reboot, or in that effort, Reboot is really to reduce clinical administrative burden. This past May, VA actually partnered with industry and academia to host 2 tech sprints to focus on how you bring AI into clinical practice to reduce clinical administrative burden. We had about 155 teams participate that nailed down to about 5 finalists. And I'm so proud of those 5 finalists because that has led to our pilot for Ambient Scribe. And Ambient Scribe is an AI solution that passively listens to providers sort of talk to patients and then generates that clinical note. So I would say most of our clinical administrative burden transformation initiatives are revolving around how AI can do some sort of augmentation to help the care team.
That's great. And it leads nicely into my next question, which is around AI, which has been a buzzword in our industry for quite some time. Are there other ways that AI is being leveraged within the industry and across public sector healthcare that y'all would want to talk about?
I mean, Ambient Scribe's really cool. Yeah, I don't think we can top that one. But for us, we just launched our own internal CMS chat. So part of what we've been up to at CMS is how do we kind of responsibly introduce AI into our programs, starting a lot internally on what are our staff using. A lot of our AI work is actually around fraud, waste, and abuse. Great use cases for AI around claims processing. And then recently, one of the things we've done as well is we launched AI demo days, in which we invited people to come demo their AI for us.
Super cool.
Thank you. Yeah, we put on an RFI. It's always good when things are free or cost $0 in the government. And we just said, come show us what you've got. We saw Ambient Scribe tools. We saw tools for, detecting different skin disease, right? We've seen a bunch of really neat stuff. And part of it was educating our staff, right? Because we don't have time to kind of sit there we're too busy writing Medicare policy to go, sit and look at all of the neat things that are out there. And so kind of bringing that into CMS and demoing it, just seeing it. So that way people understand what we're talking about when we talk about these tools.
I would say AI is a buzzword now, but it is not new. As you know, it sort of became a buzzword after ChatGPT sort of exploded last year or earlier this year. But as we have sort of participated in the AI use case inventory, we found lots of clinical use cases where AI is being currently used. For example, we have our radiologists using it for mammography to read exams. We have gastroenterologists using it for reading their exams. And so there's lots of different use cases that just haven't bubbled up to mainstream. Sure. AI is vast.
Right.
And, the things that we're sort of innovating on our sort of new technologies or new parts of AI solutions. But AI has been around for so long. I think people just need to really think about like, what are the current clinical use cases that AI has been applied, and then they'll be amazed at what we've been able to do.
Yeah, the NIH has had radiology, models approved for years at this point. So it's not new technology in many cases. Yeah.
Sure. And with AI implementation and making it successful, it has to have that foundation of secure and functional IT systems. So how can agencies best ensure that they're set up to leverage AI and automate things efficiently and effectively?
One of the things that we've been focused on at CMS is actually hiring and making sure that we have the right staff to be able to buy. We buy a lot of software, right? So knowing what we're buying, being smart about what we're buying and having ownership of it is kind of where we've been really focused. That's part of why we started the open source program office. So making sure we have access to all the source code, right? Making sure that we have new policies in place around the use of our data. We sit on huge data sets. And so one of the things we've been working on is updating our data principles to make sure that we have policies in place around using our data for training. Using synthetic data as well has been a key area. But really just kind of getting our ducks in a row before we start implementing a bunch of new technology, so that way we have guardrails up.
Right. I would agree with that. I think VA is focused on not only from an enterprise perspective, but a healthcare perspective on what our data strategy is. And included in that data strategy is really focused on data stewardship. We have so many data platforms, and every time someone says, I want to do XYZ, they go and create a new platform.
Yeah.
And so we're really trying to focus our internal stakeholders in, like, is this platform or does this platform already exist? Do we need to create something different? Because part of data stewardship is really doing the research to see if something else is already out there. Really honing in on a data strategy to move forward.
Right. Having that foundation is incredibly important. So Andrea, in our prep call, we talked a little bit about your experience prior to CMS and working across, international health systems. So I'm curious if there are any lessons learned that the U.S. and other agencies can learn from, given that experience, and what you took away from international work.
So my previous life, I worked a lot in mobile tech in sub-Saharan Africa and Southeast Asia. And I think a lot of the lessons that I learned there were, we would focus on things like offline capabilities first. So one thing that's pretty interesting about the US is that not everyone has internet.
Yeah.
Not everyone has access to internet. A lot of people use mobile phones to access the internet. So making sure that the tools that we're building are mobile friendly, offline friendly, low bandwidth friendly, that we are not always relying on the latest and greatest technology. I know it's exciting to build cool things, but sometimes we have to build really boring technology because it's stable and it gets the job done and it's cost effective. And I think that's one of the key takeaways I had was, what's the simplest solution to the problem, right? We all want to build bells and whistles, but sometimes you just need, you need a bicycle, not a fancy car, right?
Yeah.
So, and that's a lot of what my team is focused on as the digital service team, is simple solutions to hard problems, right? Not over-engineering the problem, making sure that we're picking appropriate technology for the things that we're trying to build, and really trying to think about, can we reuse something that we've already got? How are we making a more efficient and effective, CMS?
I think you brought up something that's really interesting related to the digital divide. We often get questions from our external stakeholders about how we're addressing the digital divide in terms of the veteran population. And I think we're well on our way to do that. We haven't sort of solved it fully, but anytime a veteran needs access to care and they do not have an internet connected device, we do process a digital divide consult with their social worker, and we give them some sort of mobile device, either a tablet or a mobile phone, so they can talk to their providers anywhere they are in the country. So, just good.
Yeah, there are programs like that for Medicaid individuals, but it's not available for everyone, unfortunately.
So Latrice, I'll let you jump in first on this one, but do you have any advice for healthcare leaders and how they can best prepare their organization for a future defined by scalable, data-driven solutions that really prioritize that patient experience?
I would say understanding what your end users actually need, being at the elbow, having those conversations, developing a human-centered design practice where you understand, hey, Latrice is having XYZ problem, not giving Latrice a technical solution to solve that problem, but really understanding what is the problem that she is having or experiencing, and then coming back to iterate upon that, asking a couple questions, doing some discovery sprints, and then determining what the technology solution is. Sometimes we as healthcare leaders, or we as leaders overall, we think of this really great technology, but it doesn't really help people solve an actual problem. So having some sort of discovery and human-centered design approach on understanding what those pain points are for your end users helps you define what a scalable solution is.
I think that's my fear with AI is that people are trying to find somewhere to deploy this tool, rather than finding problems and what is my best solution to that problem. And I think what we're going to see with AI moving, at least over the next couple of years, is a period of a bunch of stuff that fails because it's the wrong solution. It's just not the right thing for that problem. But somebody said, "Oh, we've got to use AI. Here we go."
Yeah.
And that's really the risk that we're going to run into if we move too fast.
Right.
It's the shiny new thing. You don't have to always follow shiny new thing. You need to actually stick to your principles. What do my end users need? And then do the discovery about the human-centered design and all that. It's hard, but if you stay grounded, you can do it.
Yeah, that's great. It's not just using AI to have AI in your capabilities, but really thinking about that challenge or, figuring out what is the best solution. So actually, Latrice, I'm going to go off script again. I loved when we were chatting offline about the digital front door. Can you talk a little bit about that approach that you've taken?
I think we are extremely focused on what the digital front door looks like for our patients, caregivers, and providers. So that means updating va.gov, where veterans can access their medical records, they can request appointments, they can request prescription refills, all by going to one seamless website versus a bunch of different other experiences that leads them also to have the same experience with our mobile app, where they can do the same thing, talk to our provider, request for prescription refill. It's a seamless experience, whether you're doing it on Internet Explorer via va.gov or whether you have the app on your phone.
It's a good app.
Yeah, it is. I've heard from the constituents. So seamless data exchange across electronic health records doesn't always guarantee true interoperability. What should healthcare organizations really prioritize to ensure that quality, timeliness, and the reliability?
I have to think about this for a second. It is challenging in the U.S. I don't know if I have a great answer for how we fix interoperability. There are rules and regulations on the books and new ones coming out right now from the Office of the National IT Coordinator at HHS. And one of the things we're looking at in 2026, what will happen is the information blocking rule, which will put penalties forward for providers that block information. But a lot of what has kind of happened over the last 10 years and will continue to happen moving forward is the private sector having to improve their sharing of data. And CMS is part of that as a large payer, but again, like we've had bulk fire APIs for almost 10 years now, and allowing and kind of helping others get to this way of sharing data pretty seamlessly. It's got to happen, frankly. I mean, it's kind of past due for the U.S., but it is something that has been dragging along for quite a while.
I would say seamless exchange sounds great, but as you've heard Andrea talk about, it's super hard. Even when you have health information exchange or a qualified health network, just really hard to do. VA serves 9.6 million veterans on the healthcare side, but that's not all the veterans across the country. So how do we get care to those? How do those veterans who are not accessing VA learn about VA or learn about their benefits? And I would say we started this initiative called the Veterans Interoperability Pledge, where health systems, community health systems sign up to be a part of this pledge, which means they will commit to share care coordination, health data, connect veterans to resources. So real time, what that looks like is if Andrea, if she's a veteran, she shows up at XYZ hospital, and they can, run a veteran API, an open source application, and determine whether or not Andrea has veteran status. If she has veteran status, then someone at that community health system can tell her about, hey, the VA offers XYZ care. We're going to link you with their care coordination team. We're going to link you with their benefits team. So your care might be covered and you don't have to pay out of pocket.
Great. So I know we've talked a little bit about cyber off and on, but I'll start with Andrea. When you, within CMS and within your organizations, how are y'all approaching cybersecurity strategies to ensure patient data and is protected and you're maintaining that public trust?
Yeah, so we recently embarked on a new endeavor at CMS. We re-updated our vulnerability disclosure program, which means that if somebody, a researcher, a security researcher or a hacker, is what the common phrase is, but a security researcher finds a vulnerability in our systems, that they can disclose those to us in a safe way. And then the new thing that we've added to that is actually a bug bounty. So for the first time, CMS ran a bug bounty this past year, and we're planning on several more. Yeah, isn't that exciting? Yeah. In which we actually pay people for vulnerabilities. So we had all kinds of security researchers coming our way. It was a new approach for us because we're kind of asking the general public, whereas usually we do internal testing and things like that. But they have tools that we don't always have available to us. They have the latest and greatest technology in order to find holes in our system. And we thought that this was a super cost-effective way to find bugs and close them before somebody exploits them. So. New endeavor, very scary to explain to leadership, but
the bear, basically.
Yeah, basically you're poking the bear, and you're telling them to go find things. But it really changed the conversations that we were having internally because, okay, wow, they found that bug. What do we do to prevent that in other systems? What do we do to prevent? Basically to get ahead of it. It's a proactive rather than a reactive strategy. So that's kind of the posture now at CMS, is a very proactive cybersecurity cultural change that we are going through, and it is a painful one.
Right. I would agree.
Yeah.
VA, I would say we probably, at least on the healthcare delivery side, we're not as focused on cybersecurity as we should have been until the Change It Network or Change It App Network happened earlier this year. Now our OINT, or Office of Information Technology colleagues, are requiring us to have a cybersecurity plan whenever we want to procure a new software. So it allows us to connect up front versus, hey, we bought this, now something's broken, can you help us on the back end and fix it?
That's great. So it sounds like there's proactive approaches on both sides.
I would say the Change Health ransomware attack this year was a huge wake-up call for the healthcare industry, and it was a moment that happened that I think it shook a lot of us to our cores of like, oh, we are very vulnerable as a critical infrastructure.
Right. Well, we are just about out of time, but before we go, I'd love if each of you could provide one final takeaway for our audience here. So Latrice, do you want to start us off?
Sure. I would just say one takeaway is that, digital health or digital transformation, it sounds cool, but it needs a strategy. And that strategy should be focused on the end users that are consuming the digital source or the digital transformation itself. You cannot just sort of create the digital transformation strategy and sort of throw it over the fence to your end users. You need to be working collaboratively with those folks who are going to consume that digital commodity.
Yeah, I mean, for us, digital transformation is a cultural change within the organization as well, and I think it's often really painful because you have to look at the people and it's not about the technology, it's about the people and the processes. Like you said, it's about the end users, it's about your staff who are working with the technology, and so there are many ways that we have approached this. One of our strategies has been, very bottom up with open source, and kind of trying to meet teams where they're at and get their technology in a place where we can share it with the outside world in kind of a radically transparent way. So that's been my strategy, but I would love to hear yours because it's really hard.
No, I would say the only thing I would be able to add to that is figuring out how you can work with your end users to understand the pain points before you like say, hey, we're going to focus on X, Y, and Z things. Those X, Y, and Z things, may not be problems that need to be solved.
Right.
Yeah.
Coming up, I'll be joined by Sasha Eric from Deloitte Federal Health to dive deeper into the digital healthcare strategies and how you can stay ahead in this ever-evolving landscape.
No matter who you are, where you are, or where you're going, Deloitte is there, and there, and even there. We are dedicated to helping people and organizations solve problems, to know faster, to grow farther, to go from red to black to green, creating impact where it matters most.
Welcome back to the Future of Care, Integrating Technology for Better Outcomes, presented by Deloitte. The healthcare industry is at a critical juncture, with technology redefining patient care, data management, and organizational strategies. Generative AI is empowering patients with more information and personalized services, while digital transformation is shifting the focus of healthcare organizations from treating illness to preventing disease and promoting general well-being. Now I'm joined by Sasha Erich, principal at Deloitte Digital. Welcome.
Thank you so much. Really excited to be here with you today.
Yeah, well, we've had a few great conversations, excited to dive in more and have your perspective that's very complementary to our previous session. To get us started, how is generative AI helping patients become more informed and really active participants in their healthcare decisions?
Absolutely. I mean, it's transforming many industries in so many different ways and such a rapid pace like we've never seen before. But for healthcare specifically and for patients, there is a variety of different things we're seeing, and probably some things that folks at home have used, all the way from better ways to navigate health and searches and what we're seeing with Gemini and ChatGPT, all the way to the specific models that some vendors like Google have created to enable you to get access to medical advice and information faster. And it's really enabling patients to get command of that information faster. It's also exposing better recommendations and information to clinicians. And on the flip side, it's enabling us to customize experiences for patients in various ways to really augment and help the experience along the way. Also to mention that there's just so much, data has always been a big topic in this area, and with generative AI tools, we're able to get much better command of it. And obviously you need very good and clean data to feed our AI models and train them. So we're seeing a lot of progression in the way that patients are served, in the way that clinicians are using these tools to be more efficient and support their patients as well.
It's really helpful. And obviously with AI and all of these new tools that we're seeing, a lot of new doors are open. So let's dig in a little bit more to personalized care and how that plays a big role in the healthcare transformation. So do you want to share a little bit there?
Yeah, absolutely. And experience personalization has been a topic that we've looked at through many different lenses, not just in healthcare. It's been a big topic for contact center operators for a very long time, but there's so much that can be done with it in the medical field. So personalization for helping patients get to where they need to get to quicker is one thing that we're always constantly focused on. And that falls more in the realm of traditional contact center optimization. So somebody calls, how do you get them to the nurse or the doctor faster? Or the more emerging set of solutions are really around personalizing medicine. So can we use AI and vast amounts of now genetic data and research data to really think about how do we personalize that medicine for somebody based on their genetic makeup? And a lot of companies, particularly in the pharma space, are seeing some really phenomenal results. Now, on the flip side of that, it's obviously allowing us to innovate faster and get better and more responsive medicine quicker, but there's certainly questions around how do you make sure it's regulated, it's safe, it's still researched to the right standards before patients are using it. But we're incredibly excited to see where that field's going to go in the next couple of years.
Right. And digital transformation is really changing how we look at the healthcare journey in general. So I'm curious, how are organizations shifting their focus from just treating illnesses to actually preventing disease and promoting just general well-being?
Yeah, absolutely. And that's so important to do that. And that's a conversation we've been having for many years with things like accountable care organizations and I remember the first time I was exposed to a couple of presentations where people said, isn't it weird that you always pay your doctor when you're sick? Shouldn't you pay them to keep you healthy?
Yeah.
And now with so much information out there, particularly again with AI and computing being cheaper and vast amounts of data, doctors can really think about how to personalize the experience, the journey, increase the number of touch points so they can help their patients stay healthier. I know for me personally, I use a medical service that has an incredibly easy to access application on my phone. So contacting my doctor with some simple questions like, hey, should I change these things in my diet? Or, hey, I don't feel well today. These are the types of symptoms. I can get faster information back. So I think just the ability to communicate with healthcare providers in that faster manner has enabled the healthcare providers to kind of coach us along the way, as opposed to just see us once a year for the physical or every time that we're sick.
That's great. And data analytics obviously also has a key, or is key to really innovation in the healthcare industry. Where do you see some of the biggest impacts, particularly in proactive care and population health management?
Definitely. Well, now that we have a lot of that data and we're able to bring it together in new ways. So traditionally, there's been a ton of data that's locked up in EHRs. There's always privacy concerns, cybersecurity concerns around it, which are still there. But the ability to bring data in new ways with newer technologies and the ability to put a lot of it in the various clouds has really, really given us a richer set of data to explore with these newer analytical tools. And I think it's really going to accelerate things that we talked about, like the personalized medicine and figuring out how to specifically, use a large amount of data to create something that's very specific to you as a patient, whether that's a recommendation or a medicine or a point in care. And then on a more macro level, I think we're also going to have the ability to enhance some decision making around population health. And we saw some of this during COVID, where complex data models were helping state and local officials and federal officials make some decisions around where to deploy countermeasures, where to deploy different resources to address the pandemic. So I think from a population health perspective, the amount of data that we have now is really going to be a game changer in helping agencies drive better outcomes for people.
Right. So I'm curious, how can federal agencies and their leaders really effectively leverage these insights for better outcomes? Any examples or best practices you'd recommend?
Sure. Well, it's, what we've seen really successful is to start on a really iterative basis, and it's hard. Change is always hard. So there are a lot of new technologies and a lot of new things that have to happen in order to get there. And we've seen a lot of success with folks that'll do some early on pilots and experiment with AI in a responsible and safe way, and then take those pilots and scale them through the enterprise. So if I had to give some advice early on, it's really setting up the right infrastructure that you need to have in place to take advantage of these technologies, and then creating a culture within your organization where folks want to show up to experiment and really raise their hand and they want to participate in evaluating these tools and deciding what works and what doesn't. And lastly, being very customer focused in testing the outcomes of these tools. So it's great that we can create a new AI model that's going to tell us how to make a recommendation quicker, but if we're not measuring how often it's right versus wrong and measuring any type of bias in it, that should always be done before it's scaled to the enterprise.
Right. So let's go back and talk a little bit more about creating that culture that really embraces experimentation and AI and automation. We talked about this a little bit with Latrice and Andrea. How can organizations and agencies really encourage that experimentation and innovation in this space? I know it takes a lot from buy-in to actual implementation, but I'm curious what your thoughts are there.
Yeah, of course, especially when everybody has their 9 to 5, right? And most people are actually serving patients, and they're either providers or trying to make sure that services are provided to citizens in some way. Some of the things that we've seen work really well is leadership messaging plays a key part in this area. And if people see that their leaders are genuinely interested and their leaders are signaling that this is something that's important to the organization and everybody should get involved, then it starts to get a following. And it's easy for people to conceptualize it these days because we see so much about these technologies in the news.
Right.
That when your boss says, hey, would you like to get involved in some type of group or cohort that's exploring the use of this, we found that a lot of folks are genuinely interested. And the second piece I would say is then recognition of folks that have participated.
Sure.
And highlighting that to the rest of the organization and some of the really good outcomes they've achieved.
Right, that's great. And why is valuing data as a critical asset really essential to driving that engagement and decision making?
Gosh, I forgot where I heard the saying, but I heard somebody say, data is the new oil. Because, I mean, look, the same adage we've said for many years in the IT profession, bad data in, bad data out. It's at the end of the day, the way you train your models, the way those models make recommendations, everything hinges on the accuracy of your data. And that data just has to be as good as possible. And you're not always going to make it perfect, but it's one of the most important dimensions to stay focused on, particularly as the quantity of data grows and the criticality of it grows as we're now using it to train AIs and make decisions and make recommendations to patients. So I think now more than ever, the quality of data and really treating it as an organizational or an agency asset that's just as important as budget or funding is something that's critical.
Yeah, that's a really strong theme I'm hearing no matter what the conversation is in digital and transformation efforts. So I think
Absolutely.
That's really helpful. So we're just about out of time, but before we go, any final thoughts for our audience today?
Sure, I would just say, look, what an exciting time to be alive, right? Gosh, I remember when I started working in the IT field, and a lot of us were still using pagers were kind of a newer thing, and then we got the phones, and then we got the flip phones, and now all of us have something that has the processor power of what used to be a desktop computer in our pockets. And now we're kind of going on to this next set of revolutionary technologies that are Gen AI and data and quantum processing, and all of them have these incredible promises of how they can revolutionize the industry, but all of them come with some drawbacks as well: cost, environmental factors, cybersecurity, ethical considerations. And I'm just always excited to see agencies that are trying to get ahead of these capabilities and do the pilots and leverage these tools in a way that's still focused on the core mission, and using them in a way that says, hey, how do I help doctors become more efficient? Or how do I pick up more phone calls? How do I get more benefits to more people that need them by using these technologies? So I think we'll see a huge transformation in efficiency over the next couple of years, and that's just incredibly exciting to me as a true homegrown tech nerd.
Well, that's awesome. Thank you so much for joining us and providing your insights today.
So thank you so much for having me. I really appreciate being here.
And thank you to our audience for being here.